Hi everyone, welcome to the second video in Anatomy for Laser, or Laser for Anatomy video series. As promised, I said we would talk about the elbow in this video. So there's lots to talk about. I've got my helpful friend again. So mostly looking at the kind of skeletal structure, but we'll kind of touch a little bit on nerves and muscles as well, because there is so much going on in this joint. So obviously we have the humeral bone, and then we have the radius and ulna, and obviously the ulna has the ever so famous olecranon, which is one of our bony prominences that we can feel. We've got the trochlear groove in there, which is where the joint, where we get that articulation. And obviously this olecranon is also where we get the triceps attach onto there. So quite a bit going on skeletal wise. We've got three major bones there. There's three nerves that generally innervate through the elbow. So we've got the radial nerve, which is very much controlling our extension, so some of our extensor muscles. We've got our median ulnar nerve, that they're more for our flexion, so help to innervate those. And then muscular wise, again, there's so much going on here. Everything from, we've got obviously the triceps back here, we've got the biceps, biceps brachialis, our pronator and supinator muscles. There's lots going on here, and we'll cover muscles in a bit more detail in another video, because to be quite honest, I could spend the whole video talking about that. Common conditions for our elbow joint. So again, really common arthritis, most common skeletal issue we have. There's also things like OCD, coronoid fractures, bursitis. Obviously we can get tendon and ligament issues that obviously will impact that elbow joint as well. Many different conditions. Now obviously the key here for me is to look at how we can maximize our treatment when it comes to laser therapy. And as I've kind of already mentioned in videos, the key here is really think about the anatomy of the structure you're treating and the condition that you're treating as well. There's no point trying to focus all of your energy in one area if actually it's a completely different area that's where the disease process is. So really thinking about the anatomical structure, what is the disease that you're treating, and where is that affecting? We're always going to be affecting, whatever the disease is, we're always going to be affecting more than just that little area. And that's really important to remember. We're not just treating that small area, but it's where we focus most of our time. Where are we going to move our probe point to point, whatever we're doing, how are we going to get the maximum effect here? So a couple of things. And I'm treating, I like most of my patients in lateral recumbency when I'm treating. I just find them more comfortable as long as they're happy to relax into that. But I also find, from an access point of view, I can get pretty much everywhere I want to be. And also it's getting those muscles to relax. We can treat when they're standing, of course we can, but I just find that I get better access, particularly when doing contact treatments, if that patient is fully relaxed and those muscles are relaxed as well. So lateral recumbency generally. And the temptation here is to focus very much on that lateral surface when we're using our probe, again, whatever we're doing there. But if you can see, if I'm holding this joint laterally to you, actually there's not much access into this joint space. And this is really important when it comes to treating the elbows, that if we're spending our time treating this lateral aspect, actually, what are we hitting? Unless we can pronate and supinate, there's very little access here. So if I come to the cranial view, again, we're getting a little bit of access here, kind of over the region here, but again, actually not getting that far into this joint space where some of our tendons and ligaments are. If I come caudally, now Access, if we just leave it like that, not great. But what about if we start putting the joint into flexion? It's a whole nother ball game getting into that joint space. And then finally, what about if we come medially? Again, different angle, not too far off treating laterally, but there is some access here. So key reason for showing you this is, don't focus all of your energy just in one angle. Like, we should be treating 360 degrees around this joint as best as possible. But don't forget that flexion extension. Are we opening up the joint space from a cranial point of view? Are we opening up that joint space from a caudal point of view? So let's really think about the anatomy of this structure. What is our goal? Where are we trying to actually get our light, our energy? We all know that whatever we start on the surface is not what we're going to get in those deeper tissues. So we have to maximize our time spent on the angles, on the areas that we're treating, to get as much of that light to that target tissue as we possibly can. So I hope that helps, and stay tuned for the next video.